So I lived for, 20 hours thinking that I had cancer. That's all. I thought I had cancer. I don't think there's a roller coaster in America that has a drop of 90 degrees. That's what it was.
My experience with IgG4 and getting diagnosed, it actually took about a year, a little more than a year, because it started out with me having symptoms of pneumonia. So I was originally given antibiotics for the pneumonia, and nothing changed after about 4 months. So I went back to the doctor, and that's when they did another chest x-ray and said, oh, you better get evaluated at the hospital. When I went into the emergency room that day, I was diagnosed with lung cancer.
Leading up to my IgG4 diagnosis was a difficult experience. I first got the symptoms, and a few months after I retired and ended up seeing about 12 doctors over the course of 2 years before I got the diagnosis. I was incorrectly diagnosed with various other diseases. They thought I had cancer.
You've been diagnosed with this disease and you're finding out it's rare, so that messes with your head a little bit.
When I was diagnosed with it, of course I go and Google it. There's barely information there, I'll say that. A lot of the information that was online were like scientific journals, right? And I couldn't, piece my way through those.
I went to read everything I could online, and there was almost nothing to read online other than in medical journals. But it's like for each page of the medical journal I would read, I would have to stop and look up a lot of terms, and even then not really understand them. So having something that the layperson can understand, I think, is really critical.
Having the foundation, IgG Forward, will be an amazing resource for any patients to come. And I would hope that it would make the diagnosis of other potential patients a lot quicker so that they can get treatment more quickly.
The foundation can help patients and help move science and medicine forward.